This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. This morning, we'll be telling you about the Mon Health Marion Neighborhood Hospital. Teased it in a show a couple of weeks ago when Chris Edwards, Mon Health Emergency Department Medical Director, joined us. Well, he has to get new business cards made up. He has another title as well. He's Chief Administrative Officer of Mon Health Marion Neighborhood Hospital, and he joins us on Mon Health this morning. Good morning, Chris.
Good morning, Dave. How are we doing today?
Doing pretty well. We also have Kelly Zimmerman, Hospital Administrator with Mon Health Marion Neighborhood Hospital. Good morning, Kelly.
Good morning.
All right, Chris, you've been on this show, I don't know, half a dozen times it seems like now, so we know you pretty well. But Kelly, let's get to know you a little bit. Tell us about yourself, how you ended up with Mon Health.
Well, I started my career with AHN up at Forbes Hospital whenever I first became a nurse, started there. And then a few years ago, I took a position with Ameris, which is a company that is partnered with Mon Health now to build the neighborhood hospital. So I started there a couple years ago whenever they built a neighborhood hospital up in Pennsylvania with AHN, and heard about the opportunity that they were building a neighborhood hospital with Mon Health, and I was really excited to try to bring what I know about the model and the care system down to Mon Health. So that's how I got to Mon Health today.
Chris, I said we've had you on here a couple of times, but just remind people about your background.
Yeah, Dave, did my residency up in Cleveland, emergency medicine boarded. I've been at Mon Health since 2007, been the ED director here at Mon Health for the past 6 years. I grew up here in West Virginia, so actually I just grew up down the road from Fairmont and Clarksburg, so to be very honest, it's great to kind of be home and be able to open this up in my own backyard.
Chris, can you explain the concept of a neighborhood hospital?
Well, so, yeah, absolutely. This is a full-service hospital, so, I think the term neighborhood hospital, even though it applies, it does get a little confusing for folks. When we've been doing tours and open houses over the last several weeks, everybody's been very surprised by the fact that this is a full-service hospital. We have 8 ED beds in a triage room. We have 10 inpatient beds. The purpose of these neighborhood hospitals are to be able to give patients care close to home. We're able to admit patients, IV antibiotics, aerosol breathing treatments, watch people with cardiac issues. And this way, when we can keep appropriate stuff in the neighborhood, they don't have to travel up and down the road to other facilities and when they don't have to, thus keeping them close to home.
Kelly, what has been the reaction from folks who've had the opportunity to tour the facilities there in Whitehall?
Well, like Dr. Edwards said, everybody is really shocked whenever they come in about the facility. It's a really state-of-the-art facility. It's beautiful. We have very large inpatient rooms that are all private, with private bathrooms for all of them. They really are just amazed at what the facility is and what we have to offer.
Chris, do you think that's because folks have this expectation that you have to go to Morgantown, you have to go to Pittsburgh, you have to go to the bigger areas to get this kind of service? Is that just a misconception?
So to a degree, absolutely. Like I said, there are obviously things we will not be able to admit to our facility that we will have the opportunity then to transfer to Mon Health Medical Center or the facility of choice for the patient. But the whole thought process behind these is to be able to provide that care close to home, specifically in terms of emergencies. Time matters in things such as strokes and heart attacks. And folks that live in the outlying areas of Marion County, just to get into Fairmont itself sometimes can take 30, 45 minutes, let alone trying to get up the road to Morgantown or down into Bridgeport. So this allows that kind of close to home, one, emergent care, and then inpatient care for the things that are appropriate for the facility. This facility, it's like I said, full treatment, full everything, full emergency room. We don't do surgeries. We don't have a cath lab, things of that nature. Those things we would have to transfer out, but we're able to keep a reasonable amount of things close to the area in Fairmont there.
Kelly, what made Whitehall a good location for this neighborhood hospital?
Well, they decided to put it in Middletown Mall. It's easily accessible. It's right off of exit 132. So it's you turn off the exit, you make a left, and you make another left, and you're at the hospital. So I think that's the main reason is accessibility.
Yeah, easy to get to, easy directions. And Chris, like you mentioned, when it comes to emergency medicine, every second counts. So if it's a stroke, if it's a heart attack, if it's some sort of an injury, time is the utmost importance. And having that location there, easy accessibility, easy to get to, all of that factors in the patient's care, doesn't it?
No, that's the absolute truth. We've been talked about this a lot, you and I, when I've been on for stroke months and things of that nature. Time is of the essence, and we're, someone comes in with an acute heart attack, we can get them treated medically into the right facility for cardiac catheterization. Folks that have stroke symptoms, if they're having an acute stroke, and it's really important because you want to stay within a 4.5-hour window because that allows us to give the clot busters to help out. Now we are using teleneurology services so that we're able to use the TPA there at the facility. So the standard of care is that of anywhere else you would go in any emergency room in America.
Talking to Chris Edwards this morning, Chief Administrative Officer, Mon Health Marion Neighborhood Hospital. Kelly Zimmerman, Hospital Administrator, Mon Health Marion Neighborhood Hospital. They held the ribbon cutting last week. We'll talk about that when we return. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Chris Edwards, Chief Administrative Officer, Mon Health Marion Neighborhood Hospital, is also Mon Health Emergency Department Medical Director, and Kelly Zimmerman, Hospital Administrator, Mon Health Marion Neighborhood Hospital. The ribbon cutting was on Friday. Of course, that brought out all the dignitaries, including Senator Manchin, who stopped by. And Chris, the ribbon's been cut. The tours have been given. When will the hospital be up and operational and seeing patients?
We open the doors for the first patients 8 a.m. Tomorrow, December 14th, which we are very excited about. This is, it's finally the day has come for what we've been putting all this work in for over the last year or so. So it's very exciting.
You already have appointments scheduled up for tomorrow?
Well, it's a hospital. We'll open the doors and wait for the first ER patients to come through.
They'll come to you. So, Kelly, how do you prepare for opening day?
Well, for the last 2 weeks, we've been onboarding all of the new nurses, new staff. We've been really spending a lot of time training them on the model and how it will operate. And we've all really grown a bond together over that time that we've been spending. Just there is a little bit of a learning gap for people with the new neighborhood hospital model. We do things a little bit differently here. It's really focused on teamwork. So we have really worked with them to learn, how it's supposed to operate in that way.
Well, Kelly, what are some of the challenges to getting a hospital open and up and running, kind of starting from scratch here?
Well, we're obviously implementing a lot of Mon Health practices, policies, things like that. We have to look at all of those and make them specific to the neighborhood hospital. Things are run a little bit different there. Obviously smaller than the hospitals that are in the area in Morgantown. So teaching the team to, work together and kind of wear different hats, in the way that, nurses need to help the techs and techs need to help the nurses, and the radiology staff need to be hands-on with the patient, running labs and things like that. These are jobs that everybody shares. Everybody's responsible for everything. we're going to work together as a team to take care of the patients.
Chris, what can the patients expect when they walk into Mon Health Marion Neighborhood Hospital tomorrow morning?
One, obviously, brand new hospital, all state-of-the-art equipment. We're very excited about it. Like I said, we have board certified physicians who'll be working in the emergency room. I will be there working in the ER at 8 a.m. tomorrow. I will be there on day one, ready to go myself. And so, we'll have the nursing staff, all of our techs and CAs and radiology, and we got full service radiology, CT scanner, X-rays. So basically whatever the patient presents with, whatever issues they're having, we're going to be able to help address for them and get them to either get them better and get them out of there or get them to the right place.
Chris Edwards, Chief Administrative Officer, Mon Health Marion Neighborhood Hospital, and Emergency Department Medical Director Kelly Zimmerman, Hospital Administrator, Mon Health Marion Neighborhood Hospital. They're our guests on Mon Health Talk this morning. We'll continue the conversation in a moment.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
The Mon Health Marion Neighborhood Hospital will be opening its doors to patients tomorrow morning. We're talking to Chris Edwards, Kelly Zimmerman this morning. Chris, you touched on it briefly a few moments ago, but with the emergency services offered at Mon Health Marion Neighborhood Hospital, what will you be able to treat? What will be available to patients starting tomorrow?
We can take care of any condition anybody has. This is a full-service hospital, full-service emergency room. Like we talked about a little bit earlier on the show, someone has a stroke, we can give TPA to help that out, which is the clot buster. We use telehealth with neurology, and we're offered telecardiology, so we can consult with our cardiologist via telehealth from here at Mon. Acute heart attacks, we can get them to where they need to go with a STEMI and get them all the appropriate medications, treat sepsis and COPD and asthma and emphysema and anything in between. This ER is no different service-wise than what I have here at Mon Health or any emergency room that you would see across the country.
And Kelly, for tomorrow, going to be at full staff, ready to rock and roll?
We're ready to go. Everybody's really excited and waiting to see that first patient.
Chris, as far as the location there, we talked about it right off the interstate. It's easy to get to, but what does this hospital mean for the community as a whole in Whitehall, Fairmont, and Marion County as a whole?
Well, it's very important to provide access to care and choice in the health care that you receive. That's what allows patients to receive the best health care, to be quite honest with you. So for us to be able to put this facility right there off interstate, right there in Whitehall, to serve Marion County and surrounding areas, to reduce time to treatment, to provide that access and choice and high-quality health care, is simply following the mission, vision, and values that we have here at Mon Health, serving one patient at a time. That is the whole idea, the whole thought process, and we're very excited to be able to bring that type of health care close to home to the folks in Marion County.
And Kelly, we talk about this a lot on this program, that Mon Health and the doctors and the nurses and all the staff, a lot of them, they're local people, and they're your neighbors, they're your friends. You go to church with them, you see them at cookouts, and that just enhances the overall experience, the overall quality of care, and that is certainly going to be the case here in Whitehall, isn't it?
It sure is.
Are you excited? What do you have to do? Is everything ready to go? You've got nothing to do today, right, Kelly?
Well, today we are going to go through some patient scenarios with staff just to kind of warm them up. They have been in training for the last couple of weeks, but we're going to it's called a day in the life. So we're going to have someone, acting like they're the patient, and we're going to go through exactly the roles that everyone will play in the care for that patient. We're going to kind of have a little ceremony with staff tonight just to recognize them and how they are the future of this facility and how they're going to, be instrumental in making this facility successful. And I think everybody's really excited to be a part of that. It's a really rare opportunity to be part of a hospital opening. And we're really ready to get it started and be here for the community.
You know, in showbiz terms, that's a dress rehearsrsal today, is what it sounds like.
Yeah, you could say that.
And Chris, I'm going to put you on the spot, and you'll probably leave somebody out, but I'm sure took a tremendous amount and tremendous number of people all working together to bring this all to fruition and the opening of the hospital tomorrow.
No, it really did. It was tremendous with our partners, Allegheny Health Network and Emaris, guiding us and through this whole process and leading us through this process. We had a tremendous group of folks there at the hospital for construction that was led by Josh Clovis. Brianna Smith did a tremendous job keeping the project on track, along with her colleagues, Julie Ferentz and Cindy Durundo and Don Carson from Emaris. Keith Dabbs with our supply chain. Nobody planned for all the hiccups that a pandemic would bring in supply chain when we started this project. So the job he did was outstanding. And then all the managers at Mon Health Medical Center who worked tirelessly to make sure all their departments were represented appropriately and ready to go down at the new hospital. They should be absolutely commended for this. It was just a tremendous team effort to get this done in basically 1 year, which is amazing.
Yeah, that's the amazing part to me. Chris and Kelly, you were able to pull this all together in about a year and get this facility up and running. Well, congratulations so far on the ribbon cutting, the tours, getting everything prepared, and best of luck as patients start to come in tomorrow. And I'm sure we'll check in again soon, see how everything is running. Guys, thank you so much for your time this morning.
Hey, thank you, Dave. Appreciate it.
Thank you.
Chris Edwards, Kelly Zimmerman, and, of course, you can always go to Mon Health's webpage to get more information. Again, the Mon Health Marion Neighborhood Hospital accepting patients for the first time tomorrow morning. That'll do it for us.